We've heard it during almost every one of the governor's coronavirus briefings. If you feel sick, call your doctor. But if you're dealing with a non-COVID related illness or medical event,
the same advice rings true. But according to local doctors, some people are not listening. Eyewitness News reporter Caroline Goggin joins us with the story new tonight.
For heart attack and stroke patients, time is key. But unfortunately, data shows some Rhode Islanders who are experiencing either medical event aren't currently choosing to seek treatment.
If you're sick and you need urgent health care, go to the hospital.
As COVID-19 remains top of mind, are other major medical events taking a back seat?
We don't know if people are just maybe exerting themselves less and doing less strenuous things, and therefore they're less likely to have a heart attack, or if maybe because people aren't driving as much, there's less air pollution, and that's part of it.
What they do know is a contributing factor to a decline in heart attack and stroke patients is fear, as many remain afraid to be in a hospital setting and potentially be exposed to the coronavirus.
No one should be afraid to come to the hospital. We are well prepared to manage any condition.
Dr. Ryan McTaggart and Dr. Herb Arano both say most people will likely recover from COVID-19, but they aren't as likely to recover from heart attack or stroke if they don't seek emergency care right away. They say the number of heart attack patients seen at lifespan facilities is currently down 30%, as is the number of calls for stroke.
We have a saying in cardiology that time is muscle. That is, the longer you wait, the more damage that you may have, and that damage is permanent.
When you wait to make the call, those minutes add up to weeks and months of disability if you survive that stroke at all.
Dr. McTaggart says the number of patients presenting with severe strokes has remained steady since the coronavirus outbreak began. For patients with cardiac issues, that hasn't been the case.
And I've unfortunately seen people who've come in much sicker than they should have, and I've seen people who haven't made it. They've come in and they've been too sick for us to save.
Both doctors stressing a message for everyone at home. If something feels wrong, seek help.
You should not hesitate to pick up the phone. EMS will be there right away, and they'll get them to the nearest hospital. And whoever takes care of them, I am confident, will render the best care possible in the timeliest fashion possible.
For more on the symptoms of heart attack or stroke, just head to our website, WPRI.com. I'm Caroline Goggin, Eyewitness News.